It's 2014 and only a few hours until New Year's. A 41-year-old woman is getting ready to go to a New Year's party along with a bunch of her friends. She's getting ready, putting on her earrings, organizing her purse, and putting on her makeup. Suddenly, she gets an asthma attack. My name is Abhinav. I'm a first-year medical student in the MD-PhD program, and today I want to talk about a case that's really interesting involving a lady and an earring. If you do want to see more of this content, please do hit the like button and subscribe. Now getting back to the case, this 41-year-old woman, which we'll name ER, is a lady that's about to go to a New Year's party. She suddenly has an asthma attack while getting ready, and she goes into her purse to pull out her inhaler. Now this isn't uncommon for the lady. ER has been known to have a lot of asthma attacks in the past. She also has a condition called Ehlers-Danlos syndrome, which is a connective tissue syndrome, where things are a little bit more pliable. Patients usually experience more stretchy skin and able to have hyperflexibility. As soon as the wheezing started, ER went to her handbag and pulled out her salbutamol inhaler. She shook it a bunch of times, getting ready to take a big whiff, but she noticed a rattle. She didn't think much of it because her wheezing was just getting worse and worse. So she took out the cap and took a huge breath. Not moments later did she feel such a scratching feeling going down the back of her throat. It didn't feel like anything she ever felt before, and it just hurt the more and more that she breathed. She thought that she inhaled a foil backing of a paracetamol or acetaminophen tablet, but the pain was just getting worse and worse as she kept breathing. Eventually, whatever was in her airway got down into the bottom of her trachea. ER didn't know what to do. She became short of breath, she had uncontrollable pain, and she was just screaming. But there was nothing that was relieving the pain. It just kept getting worse and worse, especially the more that she breathed. A few moments later, she decided that it was too much and she was in trouble, so she called an ambulance, 911. The paramedics came and saw that she was in huge distress. She was wheezing, she was hemodynamically unstable, and she had all her vital signs were indicative of that she was really panicking. What was interesting is that she didn't have any respiratory distress or anything. She was able to complete full sentences to the paramedics and was able to describe exactly what she saw and what she felt. But when the paramedics opened her mouth and looked down her throat, they saw two 1.5 centimeter vertical abrasions going straight into the trachea. Now that's really serious. There was bleeding that was happening, and there was something that definitely went down her throat. It could have been something metal, it could have been something sharp. It definitely pierced her throat. So if it goes into the lungs, it's causing bigger problems. The paramedics rushed her to the ambulance and into the hospital ER room. The patient was actually okay. She was breathing, but she was also in pain. She didn't really have any idea what was going on. But luckily, the doctors came in and did a chest x-ray stat. The chest x-ray revealed was that there was a foreign body in her right chest cavity where the bronchus enters the lung. And as you zoom closer into the x-ray, it's obvious that it's shaped like a stud earring. While all in this chaos, the patient was starting to bleed a little bit and coughing up blood. Things were not getting good, but at least we know what's causing the issue now. She has a stud earring in her lungs. What happens next is actually a procedure that's done whenever there's something lodged into the bronchus, and it's retrievable. The patient was put under, and the doctors went in endoscopically and retrieved the earring. What came out was a heart-shaped earring, and ironically, it was right next to the heart, but causing damage. There are some pictures of the earrings that I'm going to put up, and it's not really anything disgusting, but here's the culprit. As you can see, there's a lot of secretions around the earring, but it came out all in one piece and didn't do any damage, so that's the good thing. Things like this happen all the time. People swallow coins, especially children, whatever they can get their hands on. Things go down their mouth, it can get into their lungs and cause a lot of damage. Problems with breathing, problems with swallowing, all of these can contribute to this. But what's a real main takeaway from this is that you should really check your inhaler for things that are inside of it before you take a big puff. The patient knew that she heard something rattling, but in the heat of the moment where she couldn't breathe and she had to take the inhaler, this almost became a deadly situation. If the earring pierced something inside the lungs and caused bleeding, she could have died really quickly. The patient's doing well now. She's really checking her inhaler now, making sure there's nothing in it. She continues to have asthma attacks, but at least she's not having earrings into her lungs anymore. That's about it, guys. That's a case of a 41-year-old woman that swallowed an earring into her lungs, and it caused a little bit of damage on the way there. Take-home message: don't swallow earrings. Make sure you check your inhaler before taking a puff, especially if you hear something rattling before inhaling. Other than that, have a nice day. I hope that you liked and subscribed. I really appreciate it. It helps me out a lot. As always, links are always in the description to the cases. Thank you.